This is called the Alma IQ. And what it does is it photographs the skin, but it also is capable of going beyond the surface of the skin to see what's really going on deeper. It takes the skin surface, but it also looks at the texture, the wrinkles. It looks at the redness that is there. We can see pigmentation. It's going to pick all of these up with different lightings that is used. And at the end of it, the camera, which has AI technology, is actually going to provide a diagnosis. And as you see the different lights being shown now, and it's going to give us a diagnosis at the end, telling her what is going on with her skin and also which treatment is recommended. And we will soon be able to upload the universe skin that I talked about in the last segment to prescribe an individualized, personalized skincare regimen for the client.
Gorgeous lady, gorgeous. I'm just gonna go through some things, and this is your top skin layer. You can get some more information you want to read on. It's just your texture and just some things that you may be concerned about, the oiliness or anything like that. And you can go in here, so you can say your expression lines, some wrinkles or anything like that would be a concern to you. You can click them. I'm not doing that because Miss Carol is gorgeous, but maybe some expression lines, you know, some mouth. And then you can go ahead and just circle some of them.
Yeah.
Like that. Maybe a little bit up here.
What about over my lip?
And right on the chin, there's a little one right there.
Okay.
Trying to get under my eye, that's what I'm trying to do. There it is.
Good. We can work on that forehead, maybe like around the nose area when it gets cold. We know
And
get
on
that
the nose
redness.
itself.
A little right here. Maybe a little bit on the chin. We're gonna add that concern. And this is your skin, the UV light. And you can tell you wash your face really good this morning. So this maybe just came from walking out the door and coming in. And then you also have this one. You have a little bruising that hasn't. That's bruised. No, sir. It kind of shows what's brewing underneath the skin. So it's not appearing right now, but you can say maybe a year or so down the line they may
hydrate.
Yes,
drink
that's
lots
all.
of water.
So what we're gonna do now is save your plan.
Oh, you didn't even show my favorite one. Go back.
Go ahead. Show it.
Pigment. Any sun damage that we don't see on the surface. That's always the one that everybody's like, oh,
Now,
I do need.
is that sun damage or is that my natural pigmentation?
It's sun damage.
Your sun damage.
And we can't see it, but as we age, it will slowly start coming more and more to the surface. So that's why it's important to go ahead and start treating it and make it get out of there sooner rather than later.
And it's recommended our Harmony XL Pro DBL, which we do have on hand. So you can just see some of it right here, a little right here, definitely your eyelids, the mouth area.
Yes.
And we're gonna add that now. We're gonna save your plan. And Miss Carol, you can put some of your information if you want us to save this, and when we start treatment, we'll have this to reference off.
All right.
So we are numbing her for the Opus treatment.
Opus? Okay. All right.
Okay, we have Miss Beautiful Miss Carolyn right here, and she will be our Opus model today. And we will be using our focus tip to work on some of those fine lines for her. And we're just wiping on some of that numbing agent so she won't feel as much pain or heat, because that's what it's using to do. And Miss Beautiful Taylor will take over from here.
Yes.
Alcohol
Say again?
Alcohol sprinkles.
So I'm using alcohol right now because the thing is you want to be able to get that energy that we're creating with the plasma down into the tissue. And so skin prep is everything. So we ask patients to come in with a clean face. We'll have you also double cleanse while you're here. And then we'll also put the numbing on. And then I take alcohol to really strip that skin barrier so that way we can guarantee that energy is getting down into the skin.
And how long is this procedure? How many minutes?
About 10 to 15.
Okay.
So we want you to come in for a total of 3 sessions. and they're about 4 weeks apart. So that way your skin can heal up, as well as that collagen, those new collagen fibers that we're stimulating can be nice and formed. And then that way, I would say you're gonna see a result after 1, you're gonna see your peak results after 3. Awesome. You don't have any metal plates in your face, do you?
Oh, no.
Okay. You don't have a pacemaker or anything? Okay. Perfect. Pacemakers are a no-go.
You wouldn't let me in here if you'd know if I had one.
Mm-hmm.
Perfect.
I would not have been a model.
No. Yep, I
Just
asked you
because it's
before.
perfect. Awesome. Awesome. Just because I want to target those lines. And so what I'm going to do is I'm going to set her energy. I'm going to go a little bit lower because I still want to be your friend and this is your first time getting a feel for it. So we'll go low and slow, and then that way we can get used to it, and then we'll polish her off with the glide tip to get overall general resurfacing. Okay.
But if you need to go a little higher, I can do it because we've been friends a long time.
You can see with my parameters, what I picked was I'm going to go low because again I don't want to spook her too much. So I've got her at 25% plasma. Plasma's not really something that plasma intensity is not something that we got to really think about because we're not getting that ablation with this. That's just something that it's a parameter, it's available, so we went ahead and made it 25 for everybody.
Okay.
Your pulse duration is going to be that cook time. So we don't want to cook that tissue super duper long because that's where you get that hyperpigmentation. So we have it at 0.5. We're going to do 2 to 3 passes over those expression lines. I like to do this for, again, the tech neck that people are getting, for any deep set lines. Anybody that doesn't want to start getting Botox just yet, they can do this as an option as well. So with this one, you want it to press like halfway. You don't want to push it all the way in. That's too much. So in full contact and press. And this one has a beep, so you don't want to lift until after the beep is done. Are you ready? 3, 2, and 1. How was that?
That's fine.
Perfect. We still friends?
Yeah, I was prepared to feel some pain. I feel nothing. You should be doing it right.
Yeah.
Wow.
So if you're doing around the eyes, you're going to want to aim down onto that orbital bone, okay?
Onto the bone.
Not up toward that soft tissue.
That's right. This is great for under eye bags.
It is.
My system on.
Remember that when you do me.
I'm not stacking my pulses. You can also get good skin contraction up
You're
here.
not stacking the pulses.
Correct.
Good.
Again, I'm feeling for that bone up there because I want to hit on there. And that's about all I do for the eye. And then she'll see a gradual contraction as that coagulation sets into place.
Mm-hmm.
Which everybody wants a bluff right now, so that's a huge thing, our eyes. Turn towards me. Oh, actually, is it
No, I couldn't see the other side. So.
Okay.
Yeah. That's her expression line.
And I just trace it.
Okay.
Beautiful. You're doing a great job, not ironing wrinkles. So see how he's pulling that forehead taut? That's exactly what you want to do. Now, the only time that I've seen this blister is if somebody lifts off the skin and they're pushing the trigger because it's making that energy superficial. So you want to be in full contact. If the pedal's plugged in, you can do the just like the clear lift, where you're holding it down and firing with that. Sure. Let's
feeling anything, Miss McLean?
Not really, just
Just me
little
touching.
warm, just tight, little tight, kind of bit of warm.
Okay.
So she'll start to see first thing, within like the first week, she'll start to notice an overall improvement in texture as well as like her dewiness. And then around day 39 to 40, when that collagen matures, that's when she'll start to notice more of like the toning effects happen. So she'll see an overall improvement in texture, tone, and tightening over the next 3 to 4 weeks. So it'll be better and better.
And that's the one thing that we have to emphasize with expectations. I think some people expect to leave here with no lines.
So this is a good alternative to where you're naturally conditioning your tissue to be more youthful rather than putting things in that you have to maintain. So. I also tell patients, you know, the higher your energies go in later sessions, they can expect to feel like a little bit of like, whoa, okay, there's a little something there. And so I just let them know, hey, just talk with me. Just like with the hair removal. If it's starting to be uncomfortable, let me know and I can turn it down rather than you jumping away from
Any
me. I don't
heat
want
with
you
that one?
jumping away.
Nothing?
Nothing.
And do the other corner of the mouth?
So,
Or do you want me to do that?
You can do it.
Do the patients have to apply anything afterwards?
So we always recommend to do the CBD, do the cleanser as well as the moisturizer, because that is specifically a barrier restore cream. So it's
okay.
going to help rebuild that skin barrier, keep it nice and moisturized. Biggest things are keeping it moisturized with a clean pillowcase as well at home. They can put makeup on within 24 hours, but they got to use clean makeup brushes. That's the biggest thing, because a bunch of people don't clean their makeup brushes and it's something they don't think about. But clean and moisturize are the biggest things that they have to do.
Awesome.
Smell it.
Can I go up a little bit, or are we like good where we're at?
You're at 15 with your power. We're trying to get you about
It's up to
20,
you.
25.
All right, you go up a little bit.
Okay.
Megan, I think we
Yes, ma'am.
Right. And this procedure is?
So
This is the Opus with the glide tip.
Was it smoothing?
Yes, it's going to help with that resurfacing. And it's going to help with tightening and toning as well. How was that? Okay. You still friends?
Yeah.
Okay.
What am I smelling? Something burning.
So it's ablating that tissue. So it's basically giving you teeny tiny little microscopic burns to create like this ablation effect. But we're going to have a lot of healthy tissue around it, so that's why your downtime is going to be pretty minimal. So that's what you're smelling. Beautiful. A little extra. Give that a chance to kind of get angry, get ready. Forehead.
Forehead. So the forehead was more sensitive for Blake. Just so you know. So let me know if it gets too much.
Okay.
How's the pain so far?
It's fine.
It's fine. Wow. Nice.
How was that?
That's good.